From early this morning, minutes after 9, we already started welcoming several civilians, and a lot of children, a lot of parents came out. Even people without children came, interested in the fire trucks and also interested in what the firefighters do. People are very enthusiastic, and we're enjoying this day very much to be together with them and showing them what we love to do, why we are firefighters. Up to now, we could have welcomed more than 400 people, and we're just an hour after midday. So we have 4 more hours to go, and we'll see how much people will end up coming through the rest of the day. First of all, there are booths where we explain people how firefighters are all about safety and what equipment we have to assist us with that. Also, we're promoting our Fire Prevention Month, and where we are inviting people to register for us to come and install smoke detectors. We also have several vendors, as you could see, who are selling fire extinguishers. There also the Red Cross we have here, who is basically promoting their youth group that they have. And we also have our fire trucks on display, where people can get explanation on all the equipment we have on the truck. Also, children can shoot water. They can put on the fire suit themselves to see and feel how it is. Also, we have the ladder truck where children and grown-ups are climbing the ladder truck. And most of all, the children love the water slides and the jumping castles that we have here at the moment. Yes, we also have a tour through the building, and people are standing in lines to get a tour and get explanation on the dormitories, the canteen, see and feel how the firefighters live and train, and basically how they enjoy what they do. Well, as I noticed, there are actually some parents who use the children, I think, as an excuse to get on the fire truck, so that the parents could also get a ride on the truck. The ride on the truck is for everybody today, just as all the other attractions we have here. It's all about promoting safety and understanding what the firefighters do to serve the community of St. Martin.
I organized it myself, no. It had a few of us put our hands together and organize it, but the main person was me getting things together. I'm very happy and pleased how it went today, especially for the kids, because as I said before, we went out to the schools and we asked the school children to come along, and they came, and it's a packed day here for us today. We did a demonstration. We're going to do 2 more for the day, and I'm very pleased and happy to see the folks show up, and we show them around our department here today. Yeah, definitely. Next year is going to be bigger, and yeah, all firemen was here, and we showed the community our building, our training center. We had some things for the children. If you can look over there, we have some stuff for the children. It was a success for us today. Next year, definitely, it will be bigger for sure.
The purpose of us being here is because the firemen has their open house today, and they asked us if we could have come and assist them, because we have also some rides and some slides with the kids and doing first aid in case of anyone get injured. So that is why we are here, and also we are here promoting our table of what Red Cross do and also the youths. If you can see, this is one of our brochures, which is the adult brochure. What the adults do is events. We go to events. We also do first aid classes. We take part in carnival, large events, scale events, and small ones, sports. Anything that has to be with, if anyone get injured, we are there to help. Then we have the youths brochure, which is we are promoting the youths, because, you know, the youths is our future. And we the old ones, them, you know, we're taking a back stand, and so we're pushing the youths them forward.
Upcoming, we have our Tree for Life run in November, on November 15th. Next year, we're still working on the year plan, but seeing that we recently instilled a new board and we've been learning some new things, we really want to make next year a huge bang and really garner the interest of all, or as many youths possible on St. Martin, to really understand the importance of joining Red Cross and how it's a different situation where if something happens, you don't have to call somebody, you can help them yourself, and you will play a direct role in saving that person's life.
first of all, last Saturday we had our flea market by the Red Cross building, and it was a huge success. And we'd like to thank everyone that came out to support the Red Cross. Coming up on November 15th, we have our Tree for Life run, which is the last leg of the Tree for Life sports, and we're hoping that we get a good turnout so that we can raise funds and help get awareness out there about the Red Cross. And also we're currently in the process of organizing our Terror on the Beach, which has been rescheduled to November 21st. But we haven't worked out all the details, so don't hold me to that. And I think that's all the major events coming up for us for the rest of the year.
So in closing, I would like to invite anyone. We always need volunteers, because the more you have, especially now we have so many events, and yeah, you need a lot of hands, so more the merrier. So if anyone want to join up, they can always come to the Red Cross building from Monday to Friday, and they can sign up and they can find out more of what volunteering is all about with the Red Cross. I would like to thank you very much for this little interview with us.
Yeah, just like you say, I recently went to Nicaragua, and there was a disasters coordinators meeting in Nicaragua. And the purpose of the meeting was to sit together and discuss the plan 2016-2021 for disaster preparedness and management. But usually what happens during these meetings is that before you start with the planning phase, you do an evaluation of the past period, looking at the challenges we have been facing, and we did face a few challenges in at least the past 2 years. We faced a few challenges, one with chikungunya, but when it comes to outbreaks, Ms. Henry and Mr. Francisca will say something about that. But we also faced Ebola, which really tested our system. And so that is why it is also important that you look back and at the same time also discuss new challenges. And some of the new challenges that was really stressed on was climate change, and climate change especially as it relates to El Nino. And we have also experienced that on St. Martin, almost 10 months of no rain. Drought, it was so dry, and then rain, and when the rain comes, it pours down, and we know what happens. We even had to close, the Prime Minister had to close schools. So those are things that we've been discussing, and you can, of course, discuss the weather condition, but when you discuss it as health persons, you also look at the impacts it can or will have on health of the people. So that was in a nutshell the purpose of the meeting, and your question was also, what does this mean for St. Martin? Of course, what it means for St. Martin is that we have homework, and our homework is that we need to have our own disaster preparedness and management plan in place. But at the same time, our plan has to harmonize with the plan of the region, the Pan American Health Organization, the Caribbean Public Health Agency. So while you draft your own plan, you have to make sure that you are aligned with other documents that are already being developed, and at the same time make sure that there is some kind of uniformity between the countries in the Caribbean. But this was the Americas, so America was also there, Canada, Latin America, the Caribbean, and also Central America. So uniformity is also important, although when you make your plan in the different plans, you also take into consideration peculiarities that are specific. So there is a Caribbean group, and St. Martin is part of a Caribbean group that is going to draft the Pan American Health Organization Caribbean Disaster Plan. So that is what it means to us. And of course, the benefit to us is that first, we are part of a big network. So that means that whenever something happens, you know that beyond your support you have here on the island, there is a network out there that can be mobilized as soon as something happens in your own country. So that's one. But secondly also is that we prepare. Preparedness is key. Natural disasters, we cannot prevent them. Man-made disasters, we can, so we know. But when it comes to natural disasters, we are not only talking about hurricane, we're talking about other disasters also. And I was mentioning Ebola virus disease, that was really a disaster in Africa last year. So you prepare that, and with preparedness you want to make sure that all the stakeholders that play a role within disaster preparedness and management, that they know what their role is. But in knowing what their role is, they also are prepared to execute what they have to do. So that is the importance of being part of that big network, and what it means for us to prepare also for disasters, if and when it would come to a disaster.
Afford what you crave, life just gets so good. KFC, so good for everyone.
Anybody bingo? Nobody bingo.
This open house is to bring the people to the treatment, meaning people are informed before they are diagnosed. They have an idea what is going on. As you know, everyone today goes to Google and Google up their disease or their illness. Well, we are here, we are sort of Google. We are Google on land, where the people can come in and get information on sicknesses, especially the sicknesses on St. Martin. The most common sicknesses: hypertension, obese, diabetic, smoking, what smoking do to you, and also alcohol. They come here, they get the information, how to prevent that, and also get the information, if they have it, how it will be treated. And then, when it's treated, how they after have to care for themselves. So this open house is open to everyone, but it's also opening the community mind of what is out there that is disturbing our health, how we can prevent it, and how we can take care of it once we are confronted with such a disease or illness. This is a good turnout, could be better, meaning that we may even have to do it more than once a year. But just as life is, the world is in evolution, whereby you see a lot of people getting sick, people are living longer but not healthier. So these open house is to cater to those persons, to let them know you may live longer, but you can live a healthier life. And the turnout is great. It's going to get better. I think once, from mouth to mouth, someone tell their neighbor, I've been to St. Martin Medical Center, got the good information. I think those are the people going to come to St. Martin Medical Center also. Again, it's once a year. You never know if you might have to go to 2-3 times a year. But nothing beats a trial, and this is a good trial.
I want to begin by commending the St. Martin Medical Center for keeping this open house. I know as minister I visited it many times. And I've seen that it keeps growing and it keeps growing, and I think raising the awareness is, of course, the way to go. And when it comes to prevention, it is definitely the way to go, so that we can avoid the suffering and the cost of having cancer, and breast cancer in particular, since it is October 31st and Breast Cancer Month. I really, again, commend them. The staff is out here doing a wonderful job, the entire staff of the St. Martin Medical Center. And I walked around as well in the back, the electrolytes and Shirley Alfonso, they're doing also a great job. And I see many women getting their breast examinations and some of their mammograms. So again, encourage all to do this, not just in October, but throughout the year. And even though we use October to highlight it, that's okay. But as long as we keep on doing it and keep on getting our loved ones checked, our sisters, our mothers, our grandmothers, our aunts, our daughters, just making sure that they stay healthy.
Our department is the Hygiene and Infection Control Department, and we are responsible for controlling and preventing infections in the hospital. One of the things that we really want to highlight during this open house is antibiotic resistance. This is a global issue and it's a global threat. And what happens is that the common antibiotics that are used to treat infections, we are realizing are no longer working. And this is because of the abuse of antibiotics. So we are appealing to people that do not pressure their healthcare provider for antibiotics. And whenever you are given antibiotics, please take all your antibiotics and don't share them. So this is what we are actually doing. And we are keeping our staff safe and by encouraging cleanliness and hand hygiene. In this brochure, we are actually encouraging our patients and anybody else to do not be afraid to speak up for themselves. Do not be afraid to ask your healthcare provider to perform hand hygiene before they touch you. And it's, everything is the way you do it and the way you say it, but there are times the health provider is actually educated from school that before she goes to a next patient, she's supposed to wash her hands, clean your hands. So then here we are actually encouraging our patients to speak up for themselves.
Well, what you're seeing in the background here is Fish Fry Friday. We do this every last Friday of the month. All that you're seeing, there's a lot of little tents that is rented to everybody who could get a spot. And people would come cook the fish on the spot, and then the families could come and everybody could have a good time. People sell a lot of fish here. We start from 6, we start very early. So what happens usually before people go home, they will come and they pick up the fish and they will leave. A lot of fish already left the premises for tonight. But you could count that every last Friday of the month we have it. Sometimes we have a band, sometimes we have a local DJ because everybody got to make a little change. So we support the local DJ. Tonight we have a DJ that is playing. And this is what we do every last Friday of the month. It's called Fish Fry Friday. The fish fry is mainly to get St. Martin people, our people, back in business. There's a lot of people with talent, and they're just there and they can't find a job. So here you go, you got a talent, you could fry a fish, you could do a Johnny cake. We don't allow rice and all of that. So people could fry a fish and people could come here and they could make some money because we got to get our people back in the entrepreneurship spirit. I rent the tents, but I pay the DJ, I got to pay electricity, I got to pay the security guard. So I don't really care about the money for me. I want people to make some money and get back in the entrepreneurship business. This event is the biggest thing right now since sliced bread. This is what's happening here. Everybody come here the last Friday of the month, and everybody have a lot of fun. Tonight is, people think that we're expecting a little bit of rain, so we're a little flow tonight, but I could guarantee you that the amount of food that already left from here is unbelievable. So I know that the people who invested in this are making money. Well, the next one is going to be the last Friday in November. All they got to do is call me. They register, they pay for their booth. You come here from 11 o'clock that day, your booth is already here, and you could install yourself. If you look just behind me, you're going to see we have, because I sponsor some booths, right behind me we have, that is a cultural parade that we're going to have on St. Martin Day with Yume Damois. I give them a booth so that they too could be able to register some people, so I give that for free. On the other hand, over here, I give Sign 999 another booth so they could sell their St. Martin t-shirts I love SXM for, of course, for St. Martin Day. So I give a lot to the community. Like I said, it's not about me, it's about people making some money and we really bringing St. Martin back to value. Well, there's a lot of event planned for here. Everybody knows that this is Lazy Bay parking lot. During the day, you could park here if you're in the Margaret area. What we're going to do is for Christmas, from the 15th of December to the 23rd, every night we're going to have a Christmas village. We're going to have domino, ballad, bingo, tart, pudding cake. We're going to have a chanté creole, as we say in French, people singing Christmas carol. So this whole place that you're seeing here is going to be transformed in a Christmas village from 6 to 10 p.m. where every night people could come and just relax and have fun. We're going to have bouncers for the children. We're going to have all the Disney characters. So it's going to be a marvelous party this Christmas. This whole place is going to be lit up with a lot of Christmas bulbs and stuff. So we're going to have a real good Christmas village this Christmas right here at Lazy Bay parking lot. Well, hey, I'm just inviting the people, first of all, to come every last Friday of the month to Fish Fry Friday. And don't forget, you could come here from the 15th of December to the 23rd of December to the Christmas village where domino, ballad, cake, tart, pudding, everything for Christmas is going to be here. All the Disney characters and bouncers for the children. So it's going to be a great moment this December.
It's been said that behind every door, possibility awaits. How much possibility depends on which door you open first. Every day, we help our customers discover the possibilities in their lives. It all starts with a conversation. Scotiabank.
Anybody bingo? Nobody bingo.
With the rain comes mosquitoes. I mean, everyone was calling for the rain, and I was like, Lord, no rain now, no rain now, because we know once the rain comes, mosquitoes are going to come, because stagnant water is the breeding source for mosquitoes. And we know in St. Martin in 2007, when we were faced with the dengue outbreak, we were not considering or even thinking on chikungunya or Zika. But now they are here. And those three conditions are transmitted by the same mosquito, Aedes aegypti mosquito, which is a mosquito here on the island of St. Martin. So it behooves the general public to eliminate the mosquito breeding sites in our community. Of course, people are going to say, okay, we have to start fogging, but fogging does not eliminate the mosquito. It knocks down the adults. One mosquito lay like 300 eggs per one mosquito. So you must imagine, based on the amount of mosquitoes you're seeing, how much more mosquito we are going to get if we do not take action. And it is unfair or inhumane for a neighbor to be taking care of his or her yard, making sure that the yard or their surroundings does not breed mosquito, and the other person next door is allowing the mosquito to breed in abundance. Especially when you are dealing with, and I think Dr. Asin mentioned two type of persons in our community, the disabled and the elderly. The elderly probably gets up every morning, go out and clean his or her yard, and you next door having the water in the buckets and the drums and stuff just breed the mosquitoes. And when our assistant controllers go out, Mr. Francisca is one of them, go out and talk to the individuals to eliminate those mosquito breeding sites, you know, they are confronted with issues on that, and he will explain that. But our message and our call to the population is to help and to be on the alert in regards to eliminating mosquito breeding. Especially now that you are seeing a lot of mosquito, it is necessary for you to get up, and if you cannot get up, or to ask family members to turn over the buckets, to throw out the water. It only takes like 3 to 4 days before the mosquitoes start breeding, because then they lay their eggs and then they breed, and the mosquitoes the larvae turn into mosquitoes within 3 to 7 days. Within a week, you have a whole population of mosquitoes. So to eliminate that, it is necessary for us to be vigilant in regards to eliminating the mosquito breeding site, but also checking in regards to the clothing that you wear. You know, you have to wear the long sleeve shirts or blouse, the long sleeve pants, because mosquito, this particular mosquito, the Aedes aegypti mosquito, is a house mosquito. She's close to human, and it's only the female that feeds on the because she needs the blood so that she can reproduce. And if you do not use repellent, right, we ask persons to use repellent to avoid a mosquito from breeding. We ask you to wear the appropriate clothing, which is long sleeve pants and long sleeve shirt, especially around dawn and dusk, because that's the time that the mosquito is out. And one of the physicians always remind us to tell the children to wear long pants so that to avoid the mosquito from feeding around the legs and the ankle. So it's again the human, we individuals, who have to take preventive measures so that we can mitigate the number of dengue or even chikungunya or even Zika, because right now we do not have Zika, but we just need one infected person to come through our port, right? And that particular Aedes aegypti mosquito feeds on that person, and that's how the disease is spread within our community.